Assalamu alaikum, everyone. I'm Dr. Amber Sultan. I'm working as a senior instructor in the Department of Surgery and Department for Educational Development. Today, I will be moderating this session. I welcome you all to the Department for Educational Development 19th Educational Grand Round. The title of today's presentation is Undergraduate Medical Ethics Education, Sincerity or Hypocrisy. The format of today's session is half an hour presentation by Dr. Shahid Shamim, followed by panel discussion and question answer session. The link for the questions will be shared. A Google form has been created, and the link for the Google form is already shared in the chat box. So if you have any query, any questions, please feel free to share your questions via Google form. I would like to introduce our presenter, Dr. Shahid Shamim. He is a professor of surgery. He is an additional director of Dow Institute of Health Professions Education at DUHS. He is a visiting faculty to Jinnah Medical University for MHPE, Masters in Health Professions Education, and Center for Biomedical Ethics and Culture, Kenya Medical Research Institute projects. Dr. Shamim has completed his MHP from Dow University of Health Sciences, PhD in the same field from the University of New South Wales, Sydney, Australia, where his research focused on educational principles that align with the ethics education in the Asian region. Now over to you, Dr. Shahid.
Thank you, Amber. Thank you very much. Assalamu alaikum, everyone. Good to be here. Somebody needs to admit people who are coming to the waiting room. Okay, so let me share my screen with you. So the topic today is, as Amber said, it's undergraduate medical ethics education, sincerity or hypocrisy. Before we start, I am supposed to put this up, a disclaimer that I do not have any relevant financial interest, arrangement or affiliation that would constitute a conflict of interest on my part. Okay, so ethics education. It's about providing holistic care to the needs of the patient. It needs to have the human touch to medical practice. And therefore, ethics is the bridge between science of medicine and art of being a good doctor. It is well accepted common sense that good doctors act ethically with the patients. There's nothing new in this, right? So, however, in Pakistan, we are still not teaching and assessing ethics as we should be. For example, a medical graduate cannot graduate if he or she does not know the names of names of the arteries going into the limbs. However, that person can easily graduate without having the slightest idea about ethics. And when I say this, I think I'm saying this for all the medical colleges, because our examination system is formed, or our teaching and learning process is formed in such a way that ethics may be a part of the examination, but it usually is not a part which is mandatory to clear or pass to graduate. So just bear with me, because yeah. So when this is the case, and we know that for holistic care we need good doctors, then the question arises, why ethics education is so important? And as I said earlier, that our patients, they judge their physicians not on their performance, not on the science in their minds. They judge on their overall level of care that the doctor or the physician provides to the patient. And this raises some more questions like, are we teaching ethics to our students? We are teaching ethics, but are we teaching it in a way that makes sense, that makes sense in providing holistic care? And if we do want to give holistic care, so do we really want to teach ethics to our students in that way? And if we do want to teach ethics to our students in that way, then why haven't we succeeded in translating that importance of ethics in our medical curriculum? Are we being sincere, or are we practicing hypocrisy? And this was the introduction of my presentation, which is going to discuss the fundamental causes for underdevelopment of ethics in ethics education in Pakistan. I will explore with you the barriers on a continuum from apathy to ideal situation in ethics education. And then from my presentation, which is based on my experience as a faculty teaching ethics and surgery, and as a medical educationist during the last 20 years, and evidence in this area from local, regional, and national journals, I will try to come up with some recommendations to guide the medical ethics education in Pakistan. And then we can have a discussion on it where you can try the recommendations or you can agree with them. So I have identified three main factors that play their role as the main barriers to ethics education in Pakistan. And this diagram shows the three factors on their individual continuums. However, they converge to a common goal at the other end of the continuum, where they support each other in delivery of ethics education. And these 3 points are faculty for teaching ethics, text and reference material for learning ethics, and importance given by institutions like universities, HEC, and PMC. And we'll see each of the continuum one by one, starting with the third one, which is importance given by institutions. Now, almost everyone who is in this profession of teaching undergraduate medical students or medical and dental students would identify that PMDC produced a curriculum in 2011 which explicitly mentioned medical ethics and professionalism in it as a syllabus form, in the document, ethics was mentioned 21 times. Professionalism is mentioned six times. And medical ethics and professionalism, every medical school is required to teach medical ethics and professionalism for at least 150 hours in 5 years. Now, this was PMDC, which does not exist anymore. Then came PMC. PMC guidelines for medical and dental curriculum 2021, which is now present on their website, states that core competencies expected in medical and dental graduates are these, and one of them is professionalism, which includes ethics in it. It further says that professionalism's ethics and patient safety will be essential component in all 5 years of education to develop a competent physician or professional. It must be taught in a modular or system-based curriculum. So whatever curriculum you're teaching, it must be taught in it. And duration of teaching should be at least 2 weeks, which boils down to almost the same time period, or even maybe a little less than 150 hours. Now, coming back to the importance given by institutions, the factor, HEC, PMC, PMDC, and as we discussed earlier, the universities and individual faculty members, we all think that it should be taught. But what is happening is, at one end, there is empathy of regulating bodies, because they do mention it in their documents, but no action has been taken in this regard by regulatory bodies if ethics is not being taught. And this passivity towards implementation of ethics education reflects the apathy of regulating bodies. This situation forms the downside end of the continuum of importance given by institutions to medical ethics. The other end is full recognition of medical ethics as a separate discipline in medical curriculum, like other disciplines. And why I say this, other disciplines like anatomy, physiology, biochemistry, pathology, is because, as I said earlier, that if somebody does not know anatomy of limb, they can pass the exams and become physicians. But if somebody does not have any idea about ethics, they can become physicians, and even beyond that. So, on the continuum of importance given by institutions, we have apathy, that is right now the situation in which we are practicing, and full recognition at the other end. The next barrier is text and reference material for learning. Development of medical ethics in Pakistan did not start as an indigenous process. It was basically acquired from Western cultures, mostly UK and US, from where most of our faculty members are trained, along with the science subjects and curricula. However, unlike science subjects, medical ethics is highly cultural, context-based, which in Pakistan is markedly different from the Western world. Therefore, the textbooks and literature on ethics from the West may not be as productive in the delivery of contextually relevant ethics education in countries like Pakistan as they would be in the Western countries. We conducted a scoping review in 2016 using the methodology, as you can see, and we reviewed papers published on ethics education, undergraduate ethics education between 1996 and 2015. And the results were very exciting because we saw there were a lot of publications coming from different parts of the world, but somehow number of publications from Pakistan between those 20 years was only 3. There were 3 publications from Pakistan in 20 years on ethics education in undergraduate. 2 of these publications talked about the need for ethics education, and one was on a teaching strategy they used for ethics education. Now, in this situation, where textbooks are coming from Western contexts, publications are with relevance are not available, the ideal situation would be local published text and relevant publications on undergraduate medical education that can guide students and faculty for teaching and learning medical ethics according to our own cultural context. Now, coming to the third barrier, faculty for teaching ethics. In Pakistan, we have faculty from different disciplines who are forced to teach ethics in their institutes at one end. These people may belong to basic science or clinical science. They may not have any interest in teaching ethics, but by virtue of their position in their own departments, they are asked to teach ethics or forced to teach ethics. Then there are invited teachers from varying backgrounds like law or religion or general ethics, who again may not have insight into the medical profession, but because they have some knowledge of ethics or morality or law or religion, they are asked to teach ethics. Next group of teachers in some institutes are role models, and these are faculty members known for their ethical practice. However, they may not have interest in teaching ethics, or they may not know how to teach ethics. Then there are faculty members who have interest in teaching ethics. These are probably better than the previous 3, as they have their own interests, so they are motivated, they are self-directed, they volunteer for the extra responsibility of teaching ethics in some institutes. They may not have qualification or training in teaching ethics, but they are motivated and they are committed. Further on the continuum are the ethics qualified faculty who are willing to teach ethics along with their primary discipline. Again, these faculty members have their own disciplines to take care of, but because they have some training in ethics teaching, so they become the people who are chosen or selected for teaching ethics in the institute. The end of the continuum, which I say the ideal situation would be that healthcare professionals with postgraduate qualifications and training in delivery of ethics education in healthcare subjects is specifically hired as teachers for providing ethics education. Yeah, I know. It sounds really odd, right? In a healthcare institute, in a science institute, what would a social science person, or where would a social science person fit? However, in this continuum, I see the three main barriers and their relativity in ethics education or in non-development of ethics education in Pakistan. So when we say that we want to teach ethics and we want to bring ethics as a subject in our curriculum, as the PMDC or PMC is saying, as every faculty member, every university wants to, as everybody thinks that it is a requirement, then why are we not doing it? Now, it's not that we are not doing anything. At national level, there has been attempts to do this through National Bioethics Committee, who developed a curriculum for undergraduate medical education in bioethics some time back, but somehow it never got implemented. However, they have made it, and it's still in somewhere in the shelves. PMC developed standards for medical education and ethics and professionalism is a very strong part in it. International Committee for Red Cross has taken up this as a project, and they are trying to teach ethics in different parts of the country to different healthcare providers, level of healthcare providers. On institutional level, people have taken initiatives. Faculty development workshops are very common. In every conference or symposia that happen in the country, you will always find there is a separate session for ethics and professionalism, or at least a separate, if not a separate session, then in every session you would find papers accepted for ethics and professionalism. Center of Bioethics and Culture, from where I did my diploma in bioethics, they have been developing teachers for bioethics through their diploma courses, their certificate courses, and master's program. So there is some sincere effort for development of bioethics in Pakistan in undergraduate medical education. But I guess it is not enough for overcoming the barriers. Because if it would have been enough, then we would not be having this talk today. So do we sincerely want to succeed in translating the importance of ethics in medical education? Tim Remington said that sincerity is when your real purpose is revealed in your actions. And unless and until we don't take appropriate full actions towards countering the barriers of to ethics education, we will not be able to completely abolish the problem. So from that, the recommendations come in. The PMDC or PMC and HEC should recognize ethics as a discipline at par with other basic and clinical science subjects in medical education. There should be a separate department or unit of medical ethics and professionalism in every undergraduate healthcare medical institute, thereby making it mandatory for institutes to uphold medical ethics as a part of the curriculum. This will ensure dedicated, qualified, and trained faculty for providing standardized and contextually relevant ethics education in their MBBS programs. The faculty would be hired that would be qualified and trained for providing ethics education, like other subjects. Often people say that medical ethics is taught in every department, every subject, like in surgery and medicine and gynecology and peds. We're all teaching medical ethics because we are all ethical professionals and we know ethics and we can teach ethics. And my argument is that we all are graduates, medical graduates. We are all physicians in every department, surgery, medicine, gynae, peds. We all know pathology and physiology and anatomy of the subject that we are teaching. Then why do we need separate departments of anatomy, physiology, biochemistry, and pathology? Any physician or surgeon or gynecologist or pediatrician or family medicine specialist can teach these subjects. But the way a biochemistry teacher, or a physiology teacher, or anatomy teacher would know how to teach anatomy, physiology, and biochemistry would not be similar if I, as a surgeon, would try to teach anatomy and physiology and biochemistry to my students. Therefore, although we are all ethical people, we are all practicing ethically, but for teaching ethics to medical students, if we consider it as important as anatomy, physiology, and biochemistry, then we need teachers. And for teachers, we need departments and units. So recognition of medical ethics as a separate discipline is one of the first recommendations that come out from my research and observations. Number two, once we have the departments, there should be qualified and trained teachers specifically for teaching ethics. Yes, they preferably should be physicians themselves. And once you have departments and once you have a career pathway for them, then people will be making it as a specialty. They will be coming in. Like I give example of the Department of Medical Education. 10 years ago, nobody would have wanted to do a master's in medical education because there was no career progress in it. There was no career ladder in it. But now, since we have medical education departments in every medical school, medical colleges, people are pouring into master's programs in medical education throughout the country because it has become a specialty now. So once we have ethics, bioethics departments in medical institutes, we can have people coming into it as their primary specialty, and they would form the group of teachers or faculty members who can take this as their primary job. Last but not the least, we need to develop contextually relevant learning resources which are tailored to our needs, the needs of our students. Now, it does not mean that we do not teach bioethics to them, which is globally acceptable or which is required in Western countries when they move on to their specialization or they want to migrate to other countries. It only means that if we have the curriculum or the learning resources contextually relevant to the needs or to the society where we live, we will probably be more able to connect to our students, motivate them to learn ethics, motivate them to understand the problems that they may face in future or have been faced by people right now. So these are the three recommendations that come out from my presentation today. Recognition of medical ethics as a separate discipline in MBBS programs and BDS programs, trained and qualified dedicated teachers in those departments of medical ethics, and contextually relevant textbooks and literature that we should be. Pakistan is not known for as a country where people write books. There are very few number of books coming out, especially in healthcare sciences. But I think this is one subject where we need them and we should be able to develop them for our next generation. Thank you very much. Ji Amber.
Thank you, Dr. Shahid, for the wonderful presentation. Thank you. Now we move on to the panel discussion and the question answer session. I would like to introduce our panelists. We have invited faculty members who have expertise in this area. Our first panelist is Dr. Kulsum Ghias. Dr. Ghias is an associate professor and chair of the Department of Biological and Biomedical Sciences. She received her advanced diploma in health professions education from AKU. She was also recognized as a senior fellow of Advanced Health Higher Education Academy. She's a member of the inaugural AKU Teachers Academy. Our second panelist is Dr. Sadaf Khan. She is a general surgeon at Aga Khan University Hospital. She's currently working as an associate dean of undergraduate medical education and director of Center for Global Surgical Care at AKU. She's also a program coordinator for the general surgery postgraduate program. She has also completed her diploma in health professions education from Aga Khan University. Our third panelist is Dr. Tashfeen Ahmed. Dr. Tashfeen is an orthopedic surgeon at Aga Khan University. He holds a fellowship in medical education from Femur Institute, Philadelphia, and a PhD in orthopedics. He is involved in master's and PhD program teaching. So we will address the participants' questions one by one, and I would request all the participants to please share your questions via the Google form we have shared in the chat box, and then we will address questions one by one. Okay, so let's move on to the first question. Okay, so our first question is, how much does the teaching of ethics in medical education in Pakistan has to do with the importance given to ethics and morality at a societal level and in our political discourse? G, over to the panelist and the speaker as well. Yes.
Anyone in particular, Amber, or do you want just one of us to start?
Anyone. Okay, so anyone can comment. Dr. Sadaf Khan,
Okay,
Dr.
so,
Tashfeen, Dr. Kulsum Ghias. G, over to you.
Maybe I can just make one comment. I think it's an excellent question. And like many other institutions that we often question, in the past we've questioned, let's say, PCB, the Pakistan Cricket Board. All of these institutions tend to be a microcosm, or they reflect as a microcosm the situation within the country. So I'd agree with the question that in some ways, what level of importance we give to a particular area or a field or a discipline is dictated largely by what we see around us in society and where importance is given to something in society. Having said that, I think that given that healthcare professionals and our practice is essentially an ethical enterprise, the onus is on us to do more. So just because it is a reflection of the society that we live in, I don't think that we should accept it as the norm and not do anything about it. And I think that that's the argument and the case that Dr. Shamim is making as well, if I'm correct.
And I'd like to add to that and second what Dr. Ghias is saying. And the very important thing that, so when we are talking about medical education, we are looking at relatively young learners who join us, and bioethics is generally starts early. So not just bioethics, but sort of the ethics of medical practice. And I think the very important thing is that ultimately ethics is something that you learn by role modeling. So no matter how much the didactics are about how you do something, unless these young folks, when they come into medical practice, when they are exposed to clinical situations, unless they see people practicing what they learn, they will not internalize it. And here I'm talking about medical ethics, really, about the relationships between patients and as medical professionals, what our ethics need to be. So I think that's one piece that sometimes gets missed, is that because ethics was sort of taught by example and never was taught discreetly before the last 20 years or so. we have to make sure that even our colleagues and peers and faculty who are teaching students are on the same page, and that our practices are ethical, because otherwise, if these young students see successful people who have questionable ethics, then anything we do will be wasted. So that's just a comment, not necessarily bioethics, but the ethics of medicine.
Thank you, Dr. Kulsum and Dr. Sadaf. Any other comment from the panelist or from the speaker?
Amber, can I say something here?
Yes, G, please.
Okay, I think I agree with both of them. Kulsum talked about that. What Kulsum said was basically that, yes, well, education, the level of or the quality of education that you give to your students forms or molds the society that you want to create with time. And unless and until you don't educate people, you cannot expect the society to change, number one. And as Sadaf said very rightly, that the role models and are the people who students really look up to and try to they like and dislike them and see them and get inspired by them. However, I would like to add into it that unless and until students do not know, or students cannot identify or differentiate the ethical from the unethical, they will not be able to form their judgments or their inspirations from people. And I have been teaching ethics informally and formally to undergraduate students. And once they find out about what ethics is all about or how morality should be in medical practice, they themselves identify people whom they were once highly inspired by or impressed by, and they see and they understand the values, how the values are not being taken care of, or how morality is being crushed in their practice, and their inspirations and their likenesses and likes and dislikes change after that. So I think making students aware of ethical and unethical and be able to differentiate between the two types of practice is absolutely important to have the basic what Sadaf said very rightly. Thank you.
Thank you, Dr. Shahid. Okay, G, Dr. Tashfeen.
Yes, I think we've touched upon a lot of very important, many important aspects related to ethics teaching. Now, I don't think there's any question about the need for enhancing learning opportunities of ethics in the medical curricula, as well as the need to develop manpower in terms of teachers to provide the required ethics teaching. Now, and the comments by Dr. Riaz and Dr. Sadaf about how it is currently being taught and how role modeling has an important aspect. That is what is currently happening. Now, but that cannot really be considered as the standard way to teach ethics. I mean, role modeling has so much subjectivity to it, and there's so much variation among different role models. We are living in the society now. In relation to the question, we are living in a society where a lot of unethical practices in all disciplines are happening, and people who are joining the medical profession are coming from various backgrounds. So their understanding of ethics and their implementation of the ethical concept in their own practices is also highly variable. So these are the people who are acting as role models for the students. So role modeling itself is not something which people automatically become good at. To become a good role model as a teacher, now this is being recognized as a teaching strategy now. Jack and Sylvia Croes from Canada, they have written a lot about how role modeling is an effective teaching strategy. Now that requires training of how one can become a good role model for the purpose of teaching. You can have a role model and give them 5 different students, and those 5 will all come out differently. They will not all become exactly as that role model is. So using role modeling as a teaching strategy means that you provide an experience for the students which ensures that they all learn what they need to learn. So those are the things, that is one of the strategies, of course, which needs to be worked on and probably developed as a teaching strategy in the curricula. And the need for educational opportunities also implies need for trained people. In Pakistan, we have the CBEC, which offers diplomas in ethics, and Aachen University used to offer their diploma, masters in bioethics, but that has been suspended for a while. But it is we hope that within a couple of years we are going to have it revitalized. So we will. So with that, and I think Rifa University also provides a degree on professional ethics. But really, for a country as large as us and the medical needs as large as us, we are really desperately short of programs giving formal training in ethics and bioethics.
Okay,
Thank you.
So now we move on to the next question. Our next question is, how can we monitor ethical practice transfer from theory to practice once students gets graduated? So over to you.
Sorry, please repeat the question.
Okay, so the question is, how can we monitor ethical practice transfer from theory to practice once students graduated?
How can you monitor anything after the student graduate?
Any comment? Yes.
I think even before graduation, it is hard to monitor ethics. In our university, we have in our continuous evaluation certain sections on ethics and professionalism. But I really don't think that is a prominent feature of evaluations across the country. But really, it takes a lot of time to observe somebody's working to really understand what the ethical aspects are and whether they are adequately performed by the students or not. After graduation, it really becomes very hard because evaluations of faculty or evaluation of medical practitioners is really not standardized in our country at all. And those feedbacks, even if they are done, where do those feedbacks go? Do the institutions from whom they have graduated, do they get any feedback from the subsequent employers of the medical graduates? No, we don't. There's no system as such in Pakistan at present. In some countries, there are such systems, but not in Pakistan. I think that's an important aspect that we need to be able to track ethical performance after graduation also.
Well, the purpose of undergraduate education is not to, it does not include monitoring graduates after they have graduated from the university. I think it's for other bodies to work on. For example, PMC is probably developing a plan for re-registration and re-examination for registration after 10 years or something like that, like there is in the US. However, the purpose of education in undergraduate is to provide enough knowledge and skills that gives you an idea that the students may, if they want to, use those knowledge and skills appropriately in the right way, and then they're on their own. I mean, obviously, the university cannot go behind, follow every student everywhere that what they are doing, in whether it is ethics or whether it is clinical subjects or basic science subjects. You can never be sure about what they will be doing in future, but you can, unless and until you provide them the appropriate knowledge and skills, then only you can have some hope that what they will do in future would be for the betterment of the patients.
Can I add here? I agree with Dr. Shamim that this is for the licensing bodies, and across the world, licensing bodies will look at, ultimately complaints related to poor ethics, and they are the most common cause of loss of licensure, ethical issues, as opposed to practice-related issues. So I agree with that. It's a licensing body issue. The other thing I would say is sort of radical idea that ethics really starts much, much earlier. When we teach bioethics in a medical school, we are building on the ethical framework that student comes in with. And these frameworks are constructed very early in life. And so one could argue that these are things that have to be introduced as early as elementary school, what we refer to as tarbiyat in our common parlance. And, it is very hard if somebody thinks that, making a quick buck is okay, or lying to meet your means is okay, then no amount, if they have already internalized us, no amount of our lecturing them will actually change their opinion. They may sort of conform, but it won't change them inherently. Whereas those kids who are inherently very honest, who have learned that at home, will always question unethical practices, whether out loud or internally. So I would say that that bioethics is specific to our profession, but the framework develops much earlier and the country as a whole needs to look at ethical education, I think, for us to change as a society. Thank you. It's beyond the realm of us right now, but.
And not to belabor this point, because I agree with what everyone has said till now, but this whole theory to practice divide is perhaps the biggest challenge. You can teach whatever you want, but whether it's absorbed in practice and how you're able to understand that and evaluate that continues to be a challenge. For that matter, even knowing how much knowledge has been absorbed by the students, specifically in ethics as far as assessment goes, is a huge challenge. Even the institutions where we have undergraduate bioethics programs, we continue to fight or face this problem about how is it that we are going to assess knowledge of ethics. Skills and attitudes come later and are even more challenging. And that's just within the undergraduate setup. What happens when they leave is doubly so. So I think comes back to that very first question that was posed, that this is really a systemic issue and therefore needs a systemic response. So it has to be something where there is a change that is brought about top to bottom and bottom to up for us to see an actual difference.
Thank you. Now we move on to the next question. How can we monitor? Okay, so the next one is, what evidence is there that medical schools that imparts ethics education produce more ethical physicians than those that don't? So over to the panelist. Yes, any comment from the panelist?
I don't think there's any such evidence, but you'd have to look at the licensing bodies and the kind of records that they have. I am not aware of. Maybe Kulsum or Dr. Shamim are familiar with literature from that.
Okay, I think the first question, a question that should be answered before answering the question that has been asked is, what is ethical doctor? When we talk about ethical doctor, we only talk about a person who is not doing the wrong things. It's ethics teaching is not about teaching about not doing the wrong things. I mean, it's purely, the moral values come from home, from upbringing, from everything, that yes, lying is wrong. One should not lie. Cheating is wrong. No, you should not take anybody's things without asking. We are not talking about right and wrong here as in black and white. We are talking about ethics which makes you a better doctor, because the right things that you are doing as a physician, you do them in a better way. you do them in an ethical way, in a way that is best for the patient. Doing wrong things is absolutely no. We that is also part of ethics. That is also part of professionalism teaching, but that is not the main message that you want to stress upon. Wrong is wrong. There's no question about it. But when you're doing the right thing, you need to do in a better way to be a better doctor. That is the ethics thing. When we start discussing ethics, we start discussing about the absolute unethical, wrong practices that doctors are doing, right? And for knowing that stealing is wrong, you don't need any ethics education formally in curriculum. But to be able to do the right thing the right way, you need to be students need to be educated. And whether this education is going to ensure that they are going to be better ethical doctors, no. The answer is no. And literature does not say anywhere or does not prove anywhere that if you have taught ethics to students for the rest of their life, they are going to be more ethical doctors. But the only way people may become ethical or may practice ethically is when they know what the ethical practice is about. So when we are giving education, when we are educating our students or our children, we are not ensuring anything. There are no warranties and guarantees coming with it. But if we are not educating, then we are definitely ensuring that it is not going to happen.
And I think the argument that Dr. Shamim is making is for then being able to make ethical decisions. So it's about gaining the skill to have ethical decision making, applying the ethical lens to whatever situation presents itself. Because honestly, we've seen what the literature has shown is that there is always a moral decline, if anything, unfortunately. And therein comes the role of ensuring good role modeling and always having a way to boost up this ability to keep applying the ethical lens.
Yes, Kulsum, you're absolutely right. Making the right decisions, ethical decisions. But at the time of graduation, you're making general physicians who will do their house job and work as junior doctors. I think we should also come a few steps backward. I mean, we are talking. I'm sitting in a place where how doctors are talking to patients in the outpatient or admitted patients. That is a concern in the society. Doctors treating patients as human beings is a concern. Thinking about them having a consent for a procedure, that is a concern for physicians in the society where I'm seeing doctors working. Asking someone that what are the realities of consent? Why is a consent necessary for a patient to have treatment? These are the things which students do not understand and do not bring from their homes, because as somebody here said, one of the panelists said, I think Tashfeen said, that overall the society is not giving that to our children. So as a professional, a healthcare professional, as a physician, there are some expectations from the professional, and those expectations require ethical understanding of ethical practices.
Thank you. Any comment from yes, Dr. Tashfeen?
Yes, I would like to echo that it is the institutions which can really shape the nurturing of ethics in the medical profession. Not just medical profession, but the institutions have an effect on the overall society. So ethics is really a core value in the medical profession. And from there, if the institutions really take it up as an important agenda to influence the society with the ethical training that they provide to their students, then that is expected to have a major effect on the society. So the institutions can be a beacon of light, but they have to themselves recognize the importance. Do we have any department of ethics in any medical university in Pakistan? Not to my knowledge. And as Dr. Shahid Shamim has already elaborated, it is different people with different interest and training in ethics who are currently fulfilling the needs of ethics training in the medical colleges. And that itself reflects to us the place where currently ethics is located within the priorities of the medical discipline. It is partly driven by the lack of any such requirement by the PMDC, except for 150 man-hours of training. And even in CPSP, we don't have any clear directive about ethics education. So those are the things which the universities will need to pick up, even if there is absence of any regulation or by the licensing body.
Okay, thank you, Dr. Tashveen. With this, we will take the last comment from Dr. Mohammad Tariq. Dr. Tariq, over to you.
Thank you, Amber. I think it was a great session, a very nice talk by Shamim, and followed by a very relevant and very, very important discussions. I think half an hour was not enough for this discussion. Maybe an hour or two may be needed for this discussion, because such an interesting aspect of medical education we have been discussing. I agree with all the comments, and what I strongly feel that, like medical education department, there should be ethics department in each of the medical institutions. That is so important. Then, in addition to the courses and the training of the faculty as well as the students and residents, I think the role of role models cannot be minimized. I think I would strongly feel that role models are important. And but I agree with Dr. Tashveen that all sort of role models are there in the market, in the institutions, and everybody. Wrong practices doing a number of faculty members, and the students may follow those wrong practices. But I think the training of the faculty in ethics is so important, followed by role model, because it coupled. If you have good faculty members doing good ethical work, the students would learn them. If bad faculty members doing bad work, the student would learn that as well. So I think it's an important thing. I think the culture of ethics need to be established in any institutions, and I think one of them would be to have courses as well as the Department of Ethics, and everybody talking about ethics. So with that, I would like to stop, and over to you, Amber.
Okay, so any comment from Dr. Zubairi? Would you like to add anything, Dr. Zubairi?
I just feel, thank you so much. That's very kind of you to invite me to talk about it, as this has been very close to my heart. Actually, the issue is you may have all the departments, that's fine. The main area, the two areas of thrust that was very clearly brought out, and I'd like to summarize. Concepts or the components of ethics are not very well understood by the teachers. We never had an ethics course. If we don't know what we're role modeling, we're not doing a good job. So the two very important aspects. Number one, there must be a awareness session for all the faculty and all of staff, everybody in that university or medical college, to highlight what are the different components of this, just so that we can remind ourselves, for this university, this is what we're going to do, and this is what we used to do and we should do in the future, or whatever. Define ethics. Number two, and they're very different components. We have, for example, they're not just one ethics. It's patient confidentiality, it's patient autonomy, do no harm, and beneficence, and last one, the distributed justice, which is left out all of the time. So this needs to be taught right in the beginning, and it needs to be taught to the students, and it needs to be an awareness session for all faculty coming in. Then there needs to be constant refresher sessions at the beginning of every year, because everybody forgets. Nobody in this world can remember once. Lastly, where it is truly internalized is where you bring those ethics into practice. And for the medical people, it is the clinical practice or the research practice. It applies both places. Over here, the faculty have to be role models in ethics and in all the other aspects of professionalism, where they must do deliberate role modeling. And deliberate role modeling is just the same as teaching. You say what you're going to do, you do it, and you say what you did, or you ask the students what they saw. If the students do not see ethical role modeling, ethical practice, explicitly stated, deliberate, it's called deliberate, they will think that it is something to be learned, just like anatomy, physiology, and it's not related to clinical practice. So then I think is one of the most important things, if the faculty they do not know what it is. So even those who wish to practice it, do not know all of the components. The faculty also have to be educated. And then if they do role modeling, and it has to be in every rotation the students go through. It's not related to only one department. It has to be internalized and accepted, and there needs to be, just like ICRA, impact, quality, relevance, access. We need to say ethics. It needs to be a major thrust in the values of ethics, and that is something that there needs to be non-negotiable as far as any institution or even the medical profession is concerned. Thank you very much.
Thank you, Dr. Zuberi and Dr. Tariq. With these comments, we conclude today's session. I would like to thank you, Dr. Shahid Shamim, for his wonderful presentation on undergraduate medical ethics education. And I would also like to thank our panelists who took out their valuable time and gave valuable input about this topic. Thank you so much. Thank you. Thank you so much.